It was around the late 90s. I looked in the mirror and said, I want to cure acne. I don't care how I do it, I just want to do it. I'm Rox Anderson. I'm a professor of dermatology at Harvard Medical School. I practice at Mass General Hospital, and I am the director of the Wellman Center for Photomedicine, which is the world's largest lab where we study light. The Wellman Center itself has launched a lot of things that are now helping people. Starting a long time ago, we figured out that pulses of light could be used to selectively target microscopic things inside of tissue. And what got me started was taking care of kids with port wine stains. We made laser tattoo removal, we invented laser hair removal in the mid-90s. We also made the very first confocal microscope for diagnostics in the skin, which is now FDA approved and used to chase down skin cancer and other applications. Laser technology has really moved forward. I'm actually most proud of just helping people, because at the bottom line, it's like, what are we doing all this science and medicine for? If you don't actually change the way we help people in a beneficial way, then we haven't done our job. So that's what I like the most, is the feeling of actually making a difference. I'm happy to talk about acne. Sadly, it's still the #1 skin disease. And I say sadly because there's been a lot of brilliant work that's gone on. We have drugs and we have an understanding of what's going on with what causes acne. It's still very common. It's a pesky problem. The drugs have significant side effects and it interferes with social life. It's also the #1 cause of scarring on the face. I care because it affects so many people. I've learned years ago not to draw a line between things that cause disfigurement and interfere with your social life, that what you might say are cosmetic issues, and diseases that can limit life or cause major health problems. The truth is, there's no clear dividing line. It's a common cause for suicide in teenagers. So acne, even though the disease itself may burn out, the effects of it doesn't. The story with Accure starts really with the people that are currently running that company. I had this stuff in my head about wanting to come up with a laser that would actually work for treating acne. And Christopher Carlton and his colleagues literally showed up one day and said, Rox, what would you like to do? It was a carte blanche. And I said, let's cure acne. It wasn't clear at first, can we pull this off? Can we get enough power, the right pulse duration? We had to figure out a sequence of optical pulses that would target the gland safely and effectively. A few twists and turns along the road, but then we finally got where we're going. The Accure laser is doing its job. It's doing it within a fairly narrow window of efficacy and safety. The efficacy of this laser to come in a fairly short time, you realize it's 3 or 4 treatments spaced a month apart, I think we'll compete in practice with oral retinoids for the patients who have significant acne. This laser is in a way colorblind. So many of the lasers are difficult to treat people of color because they're at wavelengths that are absorbed by melanin. This wavelength is not absorbed at all by melanin. So I think you will see a wide spectrum of benefit across the skin types. I think of durability as just simply how long does a treatment that's effective really work? And I think the answer will be that this is very durable response. But a lifetime of acne scarring is a big deal. So I view this as preventative, which is another form of durability. I think what people want is they just want to know the truth. If they're going to go through a series of treatments and put up with a little bit of downtime and the redness that goes with affecting the sebaceous glands, they want to know if it's worth it. And oftentimes, the durability is the issue. I'm pretty confident that the answer is a great answer there. The effectiveness is really good. My experience in the past has been that if you come up with something that really works and it's brand new and we don't have it, that somehow the world organizes itself in a way that allows it to get out the door. And that's, I think, going to happen.